Today we're going to explore public health. There are 3 core functions of public health. These are assessment, policy development, and assurance. There are 6 areas of responsibility on which public health focuses. These are to assure an adequate local public health infrastructure, promote healthy communities and healthy behaviors, prevent the spread of infectious disease, protect against environmental health hazards, prepare for and respond to disasters and assist communities in recovery, assure the quality and accessibility of health services. We will be focusing on promoting healthy communities and healthy behaviors by talking about healthy eating in the school setting. Let's begin. Hi, I'm Lizzie. Today I'll be monitoring students' health status to see if your school community is healthy. Okay, let's begin by taking your height and weight. Who wants to go first? There are a few more measurements that need to be taken, but I can't do them here. I'm sending you to the lab where they're going to check your blood pressure as well as your blood for cholesterol and blood sugar. Now that I have all this data, I need someone to make sense of it all. I know who can help.
This is Diane, the diagnoser.
Hey Diane, would you be able to calculate some health info about our community?
I'd love to.
I'm sending you an email with some health data I collected today. Will you analyze the health of our school community?
Sure.
Thanks, Diane.
Oh, look! I've got mail. Okay, here's what I'm going to calculate. I can use the data Lizzie sent me to investigate how many students are underweight, overweight, or obese. These results might give me an idea if eating disorders may be a problem in the school. Once I get the lab results back, I can diagnose how many students might be at risk for developing diabetes. Look at these numbers! What's going on? To complete my assessment, I need to go talk to the cafeteria staff about what they've been serving at this school. And where else do these students eat in town? I need to get more data. Off to the health department! Now that we know the problems in our community, we've got to do something. I need to give someone a call.
Hello?
Hi, Nate. We need you to motivate and educate.
Hey Diane, you got Nate. I educate and I motivate. Let me look at some things, come up with a plan, and I will take it to the students. Alright, clearly I need to speak with the students about healthy eating and taking an active role in their school food options. So I'm going to have to bring together all the students and have a little motivation session. Alright, first things first. We got to start with a healthy breakfast. If we don't eat breakfast, you're going to have less energy throughout the day, and it's also going to slow your metabolism down. What that means is you're going to be burning fewer calories at rest. Then when we finally do decide to eat, our body isn't going to need as many nutrients, so most of that meal is going to get stored as fat. We need to take charge of our day right from the start and get started with a good, healthy, balanced breakfast. Second thing, you definitely need carbs, you just don't want to eat a ton of simple carbs. We need to try to stick with whole wheats and grains. Also, fruits and veggies are a great source of carbs and are perfect for snacks throughout the day. This will keep you energized and alert all day long. Last thing, this is your school and you have a choice not only on what you put into your bodies, but also you have a choice in what's offered in your cafeteria, vending machines, or anywhere else. If you don't personally feel that there are healthy options at your school, sit down and talk with your teachers, your principals, or an administrator and let them know just exactly what you'd like to see.
I just talked to Nate. These are a lot of changes. How can one person change it all? No worries, we'll work together. We can mobilize farmers from the community to sell fresh fruits and vegetables to the school cafeteria. Or we can involve a local fitness facility to donate equipment and a fitness room for students. Or we could get the local health department and hospital to provide educational handouts on healthy eating. We could do them all!
Now that we have listened to the needs of our community, we need to develop policies and plans that support our school's health. What could we include? I'm going to read our school's policies and then read about what some other schools are doing. Here are some ideas I found. We could develop a policy to offer low-fat milks and low-fat salad dressing at the salad bar in the cafeteria. We could develop a policy to offer healthy options at sporting events. We could develop policies and plans to provide nutrition information on food signs, and we could highlight healthy options in the cafeteria. By having more healthy options in our cafeteria and at our sporting events, our students will get more opportunities to make healthy choices. But how can we make sure that we are walking the walk and not just talking the talk? Let's find Lizzie.
In order to ensure safety in the school and to protect the health of our students, I plan to enforce laws and regulations in the following ways. I will make sure that the cafeteria employees portion out the correct, healthy serving sizes. I will regulate safe and health food preparations, and I will regulate that the size of trays and cups are healthy portion sizes.
We're making great changes at school. I'm worried about our students, though. How can we link these changes to the students? Let's think. Oh, I know! I can connect students who have eating disorders with the local counselor, and I'll also contact a registered dietitian so they can discuss healthy eating plans. Man, these are all great ideas, but they won't do any good if they're not carried out. Look, cafeteria workers haven't been trained in proper food handling techniques or portion control. We need to make sure all these cafeteria workers, plus all school health employees who screen students, are trained and properly credentialed. Awesome! Everyone seems to be on track now.
Now that the public health system, community, and student body have taken a coordinated action to improve healthy eating, it's time to look back and evaluate how our program has gone. In order to accomplish this, we will revisit all aspects of the intervention, including students and what their choices are within their school to check to see if they are buying more fruits and vegetables, assessing whether the students can identify components of a balanced diet, and then looking into school health and cafeteria employees to ensure that they are following health policies and procedures.
This has been such a success, but there's always more we can do.
By researching for new insights and innovative solutions to health problems, we can enhance the existing program or add new components. We could talk to other schools to learn about food options at their school.
We could search the internet to find out about school garden programs.
We could stay current with the latest on laws and policies related to nutrition.
Or we could hire a consultant that has developed successful school nutrition programs.
Now it's your turn to apply the 10 essential public health services.
We know that public health is your health, and this is public health.